Elaine from Lewes wrote me deeply concerned that the Affordable Care Act that was enacted in March of 2010 is an overreach of the federal government's role in health care. Well, Elaine, we're all, I think, waiting for the Supreme Court to render an opinion on whether or not the individual mandate component of the Affordable Care Act is constitutional. But in the advance of hearing that opinion from the Supreme Court, let me talk more broadly to what I think are the core principles and benefits underlying the Affordable Care Act, which I support. I frankly don't think it is that different from Social Security or Medicare, which are mandatory insurance programs to make sure that everyone who works is contributing into the cost of providing for their future retirement or their future health care. But I do see some reasons why folks have concerns about the Affordable Care Act. It has already provided significant benefits to a wide range of Delawareans. There's thousands of young Delawareans, those between 18 and 26, who are now covered under their parents' health care plans because of the ACA. Lifetime limits, the previous insurance industry practice whereby even though you thought you had insurance that would cover you in the case of illness, it had a cap on it so that if you got really sick, your coverage ran out in a relatively short period of time. That's been prevented by the Affordable Care Act for more than 300,000 Delawareans. Children and others can no longer be denied coverage because of a pre-existing condition. The provision preventing pre-existing condition discrimination against children has already become effective for all people, will become effective, I believe, in 2014. And last, more than 12,000 Delawareans on Medicare have already received a 50% discount on prescription drugs that were currently subject to the so-called donut hole, or a gap in prescription drug coverage. I think all of these benefits are positives. And in the end, a bipartisan, deliberative, very difficult process back in 2010 produced a bill where there was an individual mandate to buy insurance on the private market rather than a government-run, government-provided insurance market. It's my hope that the Supreme Court will uphold the constitutionality of it, and that in the end, Delawareans will be persuaded of the value for all of us of the Affordable Care Act. But I appreciate you sharing with me your concerns, and I am someone who is willing and open to listening to concerns and issues that come up as we move forward to responsibly implement the Affordable Care Act.